It is hard to get depressed after you look at what medical innovation does. And let me just give you some quick facts about the economy and the connection of healthcare and medical innovation to the economy. Healthcare and economic issues are inextricably intertwined. The U.S. healthcare sector accounts for 17% today of gross domestic product, a 1.1% increase compared to 2008. And listen to this. This is the fact that just knocks me out. During this 2-year recession that we've been in, we have lost jobs in every sector in the economy save for one: healthcare. Get this, 700,000 healthcare jobs have been added in the last 2 years, while every other area was getting rid of jobs. So in just looking at this, and I'll go more in a second, I'll give you more good synergies that come out of this. We decided let's put everybody together. So let's get the disease groups, who are always obviously interested in finding answers. Let's get the pharmaceutical companies. Let's get the biotech companies. Let's get the universities and colleges that do a lot of the NIH research. Let's get other research organizations and foundations. And let's pull together a national group that can study this area and come up with a simple but effective and straightforward agenda that we could then begin to drive in the government, with the private sector, with everybody, to try to get medical innovation to be more successful, more profitable, a better part of our economy, and a better answer to many of our big healthcare problems. So we think in the first instance to attract more public and private investment necessary to fund the breakthroughs in innovation that'll create jobs and ultimately cure devastating diseases. We're delaying the arrival to market of critical treatments and next-generation therapies. And we're not doing enough to cultivate the next wave of scientific and medical innovators. What the Battelle study shows is that there are 4 distinct challenges across our nation's medical enterprise. Number 1, gaps between basic research and translation of medical innovation into actual treatments that can be deployed with patients. Second, shortfalls in private investment for company formation, research and development, and related manufacturing job growth. Third, a lack of consistency and predictability in U.S. Food and Drug Administration regulatory review, and uncertainties in reimbursement and new standards caused by healthcare reform. Fourth, limitations in cultivating the innovators, the human capital of the future in this industry. In the days ahead, we will be meeting with members of Congress, the Obama administration, and as we are today with state and regional officials, to highlight specific steps that we believe must be taken in the near term to ensure that medical innovation becomes a cornerstone of our economic recovery. You know, someone said a moment ago that the governor was very helpful on the patent issue in the healthcare bill. I'll say it again, all of politics is local. If you want to drive a national agenda, you got to get down in the grassroots where people really understand where the rubber meets the road and drive that agenda from the local level. And that's why we've asked mayors to be here today, and state legislators and business leaders and union leaders and people from all walks of life who are interested in this area, because at the end of the day, our success in getting this agenda to be partially or fully realized will depend on the political pressure that we're able to force up from the grassroots into the federal level. As part of this effort, we're calling on the Obama administration to give an appropriate federal office the responsibility to lead collaborative efforts to address the key challenges we face. We simply feel that, you know, every time you come up with an agenda in some area and somebody says, well, that's just add that onto the list, you know. And so it falls through the cracks. We think this is so important to the economy, to our healthcare system, to healthcare costs, to quality of life, that somebody within the administration, either in one of the departments or in the White House itself probably, is charged with the responsibility to drive this. I used to say when I was leader, how are we going to get the water up the rope? It's hard to do if you've ever tried it. That's what this takes to get this stuff to be realized. So, we believe the following areas to be priorities for the near term. First, we must form private-public partnerships that will drive translational research and bridge the valley of death, the gap between development and delivery of life-saving medicines and treatments. Now, I'm not really a scientist, so I have trouble understanding a lot of this stuff. So I had a scientist give me an analogy so I could understand the valley of death. I said, I don't understand the valley of death. I remember Ronald Reagan had, you know, he gave those soap ads on the Death Valley, but I think this is different. And the scientist said, well, let me give you a football analogy. You may be pretty dumb, but at least you can understand that. So NIH, $30 billion a year. Not enough, incidentally, but $30 billion a year. When Newt was leader and I was leader, we didn't agree on a lot of things. One of the things we agreed on about 10 years ago was to increase NIH funding from 15 to 30 billion. One of the best things I ever participated in. Hasn't gone up since then, so it's been stuck and it needs to be unstuck. But $30 billion a year in basic science. So he said that gets you from the end zone to your first 10-yard line toward a remedy. So he said you got to go, if you're a private company or even a university, whatever you are, you got to go 90 yards to get it to bedside. Costs about $1 billion, sometimes $2 billion to run that 90 yards. And 90% of what you try fails. Oh my God. What kind of a business is this? I mean, who would do this? So what he said was you got to get 10 more yards or 20 more yards or even 30 more yards through some private-public mechanism that can afford to do this. Private sector can't do it alone. You know, we got a lot in the Republican Party, I guess. If you're on the far right, you think the private sector should do everything, government should do nothing. If you're on the left side of the Democratic Party, you think the government should do most things or everything, and private sector is just voracious for profit and never does anything right. Truth is, they're both right and they're both wrong. You got to have a private-public partnership to do some things. And this valley of death problem requires that partnership. And so we're seeking, if you read the full report, you realize this is easy to say, hard to do, and we're trying to figure out ways that can happen between universities, the NIH, private sector, so we get those 30, 40 yards picked up. Second, let's create the right market environment that enables innovation to thrive. One immediate opportunity, and it's being talked about right now in Washington, in the House and in the Senate, is an effort to strengthen the federal R&D tax credit by making it permanent. Wouldn't that be a good idea? You know, they reenact these tax credits like every 2 years. So you know, one of the horrible things in business is uncertainty. I mean, you're going to go through the valley of death and it takes 9 years and costs $2 billion and you don't know if the R&D credit's going to be there? It's ridiculous. You got to have it. And it's got to be permanent and it's got to be increased. They're talking about it right now. We haven't had enough time to really, you know, shake the tree here, but we're going to come back at them because it'll probably expire in 6 months or something. And we're going to really talk about making this thing permanent and getting them to understand why it has to be. Third, we must enhance regulatory science efforts at the FDA by funding a collaborative effort to implement a science-based benefit-risk framework guided by government, patient advocates, and industry. The really good news here is Francis Collins, new head of the NIH, Margaret Hamburg, who's the head of FDA, are meeting regularly. They just published an article that I refer you to in the New England Journal of Medicine this week or last week that talks about their effort to make regulatory science better and to do a better job of the challenge of personalized medicine and the Genome Project, all of which we know changes the game dramatically. And so helping them, encouraging them, getting Congress to support their efforts will be very, very important. And finally, it's incumbent upon our nation to do everything in our power to ensure that we're cultivating the next generation of researchers. Without them, our chances of ensuring our competitiveness and addressing our health challenges will be greatly diminished. I was out at the University of California at San Francisco about a year ago, and the head of the department brought out 8 or 10 of these young people in their 40s, that's young, 30s, who had been doing research on Alzheimer's. That's all they'd done, and the Department of Neurology, and they all told their story and what part of it they were working on. One guy had worked for 20 years on one problem. And I got to tell you, at the end of it, I had tears in my eyes. These people are unbelievable. What a magnificent passion to have, to spend all that time and effort trying to find one part of this huge problem that we face in this country. We need our kids in K through 12 to see these researchers. It needs to be the new space program, in my view. These folks are our astronauts. And we need to educate and inspire our young people and motivate more of them. Yes, I want math. Yes, I want science. I want to do that. I want to find the answer to Alzheimer's or cancer or whatever it is.